Hello, Dr. Shefali. Thanks for joining us today and thanks for taking out the time to speak about breast cancer.
My pleasure, Divya. Nice to meet you too.
Yeah. So I'll get started with my first question, which is what are the symptoms of breast cancer and when should one reach out to the doctor?
All women should be doing a self-breast examination starting from the age of 18. And the symptoms and things that they should look for, which are early signs, are a presence of a lump or thickening in the breast or armpit, change in size or shape of the breast when you visualize yourself in the mirror, dimpling or puckering of skin, retraction or pulling in of the nipple, any swelling, warmth, redness of the breast, itchy, scaly, sore rash of the nipple, and nipple discharge, particularly if it's bloody and one-sided, or
Mhm.
new pain at one spot that doesn't go away. These are some of the things that every woman should be aware of, and if she notices any of these signs, she should seek help from her either a gynecologist or go see a breast surgeon directly. They are
Mhm.
concerning signs and important that they are fully evaluated with further tests and imaging.
So could you describe the types of breast cancer and what different stages of breast cancer mean?
There's basically one which is the most important type of
Mhm.
breast cancer, which we are all familiar with. It's called invasive ductal carcinoma, and that accounts for most of the breast cancer cases that we see. The lesser common variety is invasive lobular cancer. The staging systems are the same for both of them. And early stage breast cancer is where the cancer is confined to the breast. A little bit more advanced breast cancer is if it has spread to the lymph nodes in the armpit, and
Mhm.
metastatic breast cancer or cancer which has spread beyond the breast into the lungs, liver, bones, those would be considered as stage 4 breast cancer. So stage 1, stage 2 is considered early breast cancer. Stage 3 is advanced breast cancer. Involvement of skin, etc., becomes locally advanced breast cancer, and spread beyond the breast and armpits becomes distant or metastatic breast cancer, which is stage 4.
So according to you, who is at the most risk of getting breast cancer?
All women are at risk of getting breast cancer. Some women
Okay.
are at greater risk, some women are at average risk. And that is why all women starting at the age of 40 should be undergoing an annual ultrasound, breast ultrasound, and mammogram to look for presence of breast cancer early. That will help with early detection. And it should be clearly understood that mammogram is the only accepted method of breast cancer screening. Breast
Mhm.
ultrasound is an adjunct to mammogram. Breast ultrasound by itself is not adequate and is not considered a screening modality. So you are not screened for breast cancer unless you've had a good high quality mammogram done. And then to supplement that information, a breast ultrasound is also recommended. And for women starting from the age of 18, as I mentioned, self-breast examination is an adjunct to detecting any lumps or any changes which may not have been otherwise picked up. But also let me clarify: self-breast examination is not an accepted method of breast cancer screening. WHO merely recommends that because women become aware of their breasts, then they look for changes, they are aware that they need mammogram, but by no means walk away thinking a self-breast examination is adequate to screen for breast cancer. You need a mammogram every year starting at the age of 40.
So is there any link between the menstrual and the reproductive history and breast cancer risk?
There is a link. Women who start their menstruation early, say before the age of 12, and who have a delayed menopause, these
Mhm.
women have unopposed estrogen. The breast is exposed to a longer duration of estrogen, which is a female hormone. And so they become at slightly increased risk for developing breast cancer. But apart from an early menarche or a late menopause, um, that's the only criteria which may contribute as which may be considered as a risk factor for breast cancer. As far as the reproductive cycle goes, women who've had no children, no pregnancy, those are again at increased risk of breast cancer because of the unopposed estrogen in the body. Women who've had children have progesterone levels, which opposes the estrogen, and therefore the greater the number of pregnancies, the more protective is that hormone level from developing breast cancer. So breastfeeding, pregnancy are all protective incidents in the life story of a woman, which will protect her from developing breast cancer. Also, a lot of the women are now undergoing what is called infertility treatments, which is IVF and other methods of conception. Each of these infertility treatments usually involves giving the woman extra exogenous hormones, which means external doses of hormones to assist with with either conceiving or maintaining that pregnancy. The doses given are usually very minuscule, but if you're not in the hands of a good gynecologist, these doses can be pretty high. And in that case, yes, those estrogens given during infertility treatment can contribute to the development of breast cancer.
So that's actually really, really important to know. So as far as the diagnosis goes, how is breast cancer diagnosed?
Self-breast examination
How
is
is,
how they, or a gynecologist, when she examines the patient, she will pick up the changes in the breast, and then you will get evaluated by a breast cancer surgeon. And the typical initial tests that we do are a breast ultrasound and a mammogram, which are very highly accurate and very sensitive in picking up breast cancer. And after that, depending on what further testing is required, usually in most women, they are able to reach a diagnosis with these two tests. And then if as necessary, we can request needle biopsy to further assist with getting more information about that breast cancer.
so in terms of treatment, like what are the treatment options available?
The treatment for any cancer is
Mhm.
has three arms to that treatment. One is surgery, the other one is chemotherapy, and the third is radiation. So for cure of any cancer, we usually use a combination of these three treatment modalities, and the same would apply even to breast cancer. There are two types of breast cancer surgical treatments. One is a mastectomy, which involves complete removal of the breast. The other one would be breast conservation surgery, where we remove the tumor, sample some lymph nodes in the armpit called sentinel lymph node dissection. And if a woman goes for breast conservation therapy, she will need surgery followed by chemotherapy, depending on how aggressive the tumor is, followed by local radiation to the whole breast. If the woman opts for mastectomy, in most cases, we can avoid the radiation unless it's a very advanced tumor. So surgery followed by chemotherapy. Those are the three modalities and combinations. And if it's a very advanced cancer to begin with, and a woman is keen to preserve her breast, then we give chemotherapy upfront to downstage the tumor, reduce it in size, make it amenable to breast conservation surgery, and then take it forward.
So what can we do to actually lower the risk for breast cancer?
You can't really alter the risk because it's genetic. If there is a strong family history in your family, your mother, sister, and other related cancers like pancreatic cancer, prostate cancer, if you have a history of these kind of cancers in your family, then there can be what we call genetic screening. The mother or the sister, whoever has the breast cancer, can be screened for presence of genetic mutations, which include BRCA1, BRCA2, which we are all familiar with. If the patient is positive for any of these genetic mutations, then other family members will have to be screened for that. And if you do turn out to be, positive for any of these genetic mutations, then you would be appropriately triaged to further therapy. You don't have cancer, but you have the genetic mutation. Then there are various things that can be done. You can either be given chemoprevention, which would reduce your risk, or you may be advised to have prophylactic, which is preventive double mastectomy. So that would depend on if there is a genetic mutation in your family. How can you reduce how can you alter the risk? Well, if there is a genetic mutation, then by having preventive surgery, you can reduce the risk by taking some hormonal pills, which is called chemoprevention. You can reduce the risk. If you don't have a genetic mutation, then the only way to improve your survival and outcome with breast cancer is to do breast cancer screening starting at the age of 40 at a good center with good images, and follow up with the breast cancer surgeon as necessary. It's very important that the quality of imaging is good. Quality, because they'll just write, she doesn't have any cancer, and they may have actually missed it. So it's not acceptable to get a poor quality mammogram or inexperienced radiologist to interpret that. It should be done at a good center. And then, yes,
Okay.
uh, you can be declared as cancer free.
What are the surgical options for women with breast cancer?
That's a very good question. There are two main surgical options for women. One is the traditional method, which was complete removal of the breast and removal of all the lymph nodes in the armpit. That is the traditional and the old 1950s operation, but it was curative, which is why it was the operation of choice up until about 20 years ago. Now we have breast conservation surgery, where you can preserve the breast and only take out the cancer with a margin of normal breast tissue. And instead of taking out all the lymph nodes in the armpit, we sample them and take out the 1, 2, 3, or whatever number, few lymph nodes, which are the primary drainage area of the tumor. So the advantage of this is, one, the cosmetic appearance of the woman is preserved, her self-image is preserved because her breast is maintained. And instead of taking out all the lymph nodes, which would predispose to developing edema of the entire arm, numbness of the inner aspect of the arm, all these side effects are avoided because only a few lymph nodes are taken out and sampled. So it avoids all the morbidity of doing a complete lymph node dissection, and it preserves the woman's breast. So it's a far more satisfying and gratifying outcome. And most of these women are far more satisfied with the quality of their life, a few years out from the treatment of breast cancer. So breast conservation surgery is usually the surgical procedure of choice, particularly in women in the West. But now, in my experience in India, also most women are opting for breast conservation surgery, and 90% of our practice, we are able to offer breast conservation surgery in India as well. So it's a complete myth that women in India come to you with advanced breast cancer. They are coming to us mostly in stage 1 and stage 2. They are aware, they are doing self-breast examination. Most of them are self-detected breast lumps. And we are also seeing some women who are doing regular mammograms, and they're picking up suspicious lesions on mammogram. So we see a lot of early breast cancer, which is amenable to breast conservation surgery, gives them excellent survival outcome and preservation of the breast. I also want to reiterate that complete removal of the breast, total mastectomy versus breast conservation surgery, they both have identical survival outcomes. So no woman should think that by saving my breast, I'm actually going to lose my life later on. No, you're not. We never compromise on survival. Survival is paramount in surgical oncology and treatment of cancer. So keeping the survival equal on both sides, we strive to give you a better quality of life, which is achieved with the breast conservation surgery. And you can get more information on this on our website, gibreastcancer.com, where you'll be able to compare the two modalities.
I
So I
will
would
definitely
encourage
yeah.
every woman should consider, every woman diagnosed with breast cancer should be evaluated and considered for breast conservation surgery. It's really the woman's choice if she declines breast conservation surgery for some reason, but she must be evaluated and offered breast conservation surgery when the diagnosis is complete.
So in your opinion, like statistically speaking, what is the survival rate usually with women, who have breast cancer?
That's a very good question, and I'm glad you asked it. Women who are diagnosed with stage 1 breast cancer have a survival rate exceeding 90 to 95% at 5 years and longer after that. Women who are diagnosed with stage 2 breast cancer, the survival will be slightly less depending on the size of the tumor. Women who are diagnosed with stage 3, where it has spread to the lymph nodes in the armpit, the survival will fall from 90% to about 60-65%, which is why early diagnosis is very important before the cancer spreads. Because as you can see, just by involvement of the lymph nodes, the survival falls dramatically to 65%. Women who are diagnosed with stage 4 breast cancer have a limited prognosis, have a limited survival, and that would largely depend on the type of tumor, but that survival can range from a few months to a couple of years. So early diagnosis is very important. Stage of the tumor at which it is diagnosed is what determines survival. So come early, screen yourself, get diagnosed early if you're going to get breast cancer, and you will have an excellent survival outcome.
So what is the rate of reoccurrence? breast
Excellent.
cancer?
Excellent. Okay. That will depend on number one, you should have a successful surgery. I am compelled to bring this up because I see a lot of bad cancer operations as well in my clinic. And if you do a botched up operation, the tumor is going to come back. Because what a botched up operation means is that you've left some cancer cells or part of the tumor behind in the breast. And if any part of the tumor is left behind, no amount of chemo or radiation is going to take care of those cancer cells. They will grow and a recurrence will happen. With successful treatment, the breast cancer recurrence rate is very, very low. It's in single digits, less than 10%. And that is the accepted rate of local recurrence. And with successful treatment, it remains very well controlled. And with the chemotherapy, when required, the recurrence is prevented at distant sites like lung, brain, and liver. So we get good outcomes. But yes, I mean, with cancer, the chance of recurrence is always there. That is why women, even after successful and full treatment of breast cancer, have to remain on follow-up with a breast cancer surgeon to detect any recurrence in time.
So is there something like with the age, if you are, younger, then probably, you would have more success towards the treatment than, you are older, and the rate of
Actually,
reoccurrence?
if such a thing exists, and it's the other way around. Older women tend to have less aggressive tumors and more hormone responsive tumors, which tend to be slower growing. The younger women may have more triple negative tumors and a little bit more aggressive tumors, but there is hope for all of them. All categories of these tumors are cured, and cure will not depend on age. It will depend on your type of tumor and the successful treatment that you receive.
Well, this brings me to the end of this video. Thank you for watching. If you like the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram.